Thanks for visiting my channel. Today I'll be talking about Delafloxacin. Delafloxacin could be under the trade name Bactericidal. As per class, Delafloxacin is an antibiotic belonging to the class of fluoroquinolone. It could come in form of solution to be reconstituted for intravenous use. And in that case, it's going to be Bactericidal 300 mg or in form of tablets for oral use only. And that could be Bactericidal 450 mg. Administration. You can give Bactericidal or Delafloxacin per oral with or without food. You can give it 2 hours before or 6 hours after Antacids. Intravenous infusion should be over 1 hour at least. We don't give this medication with cations or cations containing solutions or any other medications that will interact with it negatively. You should either flush the IV line with normal saline or D5, or you use another line entirely if you are bringing Delafloxacin for the first time in someone already on IV medication or any other thing through the intravenous route. Dosing in adults. If you are handling community-acquired pneumonia, you may give Delafloxacin intravenously at 300 mg every 12 hours for 5 days. If you have chosen the oral route, you can go for 450 mg every 12 hours for 5 days. If this is skin infection, you may choose intravenous route at 300 mg every 12 hours or per oral route 450 mg every 12 hours for 5 to 14 days. In renal impairment, if we are dealing with increased creatinine, please don't give Delafloxacin intravenously. Instead, use the oral route. And if this case is end-stage renal disease or the estimated glomerular filtration rate is less than 15 ml per minute, then don't give Delafloxacin at all. None at all. If eGFR is less than 15 ml per minute, if estimated glomerular filtration rate is between 15 and 29 ml per minute, decrease the IV dose to 200 mg every 12 hours from 300 mg, right? Now the coverage. Delafloxacin will be helpful when we're dealing with methicillin-resistant Staphylococcus aureus. That is a plus, right? Because that's a big problem. So instead of looking for some other big antibiotics, can grab Delafloxacin. Streptococcus pneumoniae, Klebsiella pneumoniae, Escherichia coli, Pseudomonas aeruginosa, Haemophilus influenzae, Legionella, also in Mycoplasma, in Chlamydia, in Enterococcus faecalis, Staphylococcus, Streptococcus, Enterobacter, and Haemophilus parainfluenza. Elderly patients taking Delafloxacin should be told that they stand the risk of tendon rupture. It's not that this cannot occur in other patients, but elderly patients will have more probability or higher risk of having tendon rupture in them. In other words, if you have other medications and other antibiotics that you can use, don't give it in elderly. Contraindications. Please kindly check my full presentation on fluoroquinolones and todavecamess right here this channel. and check out what the contraindications to the use of fluoroquinolones are. Then is applicable. But in addition to what has been published already, hemolysis may occur in individuals with G6PD deficiency. Monitoring: white blood cell counts, infection signs, renal function tests, blood glucose, and urinalysis. For mechanism of action, please kindly check my presentation on fluoroquinolones already published right here, that is adds to the MRSA. The same for adverse reactions, there are lots of them. Please do, it is expected that Delafloxacin will have less adverse reactions, but we have to check what the possible adverse reactions will be and let the patient know before taking the medication. And for you to have a comprehensive list of that, please check my channel right here. Full presentation on fluoroquinolones at MRSA. You can just check MRSA and look for fluoroquinolones. I think it's just the presentation before this very one. Drug-drug interaction, the same. Check fluoroquinolones at MRSA for drug-drug interaction, and your pharmacist may also be helpful, the same as a clinical pharmacologist. Warnings, the same. Check my presentation on fluoroquinolones right here, that is at MRSA. With that, I've come to the end of this short presentation as per Delafloxacin, the newest generation of fluoroquinolones. We expect these to cover more ground as per many bacterial infections, but we expect less side effects. However, because the newer drug, we have less information about it. You can have your back prepared by yourself as a physician by going through my full presentation on fluoroquinolones to know what the possible side effects could be, what contraindications could be, what the warnings could be. Thanks for listening. Remember to share this very presentation. Remember to subscribe to my channel. I appreciate it.